Welcome to Welcome to LTU Perspectives, a journey into the experiences, stories, and adventures at Lawrence Technological University, a student-hosted podcast filled with insights and the intriguing stories that embody the LTU spirit.
Welcome to LTU Perspectives. My name is Marisa Zilli, and my guest today is Ken Winter.
Hi, how are you?
Thank you for being here today.
Mm-hmm.
A little background about my story is that I am a previous Lawrence Tech graduate, and I am now returning to further my career to go into something else. So my previous degree was in media communication, and life took a different turn. I found passion more so in the helping profession of nursing. So my degree previously was in media communication. I was young when I chose it, and I realized that it wasn't technically my passion. And as I got older, so 10 years later, I got an opportunity to come back to school and take up nursing. And I was very excited about it. Had a different idea about school, was enthusiastic and happy to learn again. So I'm excited to be back and learning again and appreciative of the opportunity I have here at Lawrence Tech because they actually didn't have a nursing program 10 years ago. So I didn't even have that option back then, and the option was media communication, and it drove me quite a bit, and I'm happy that I do have it because now I can take those aspects and apply it in a way in nursing that gives me a voice, and I also can be vocal in the health profession. So Ken, what made you get into nursing?
So originally I went to Adrian College where I was playing hockey, and I was doing exercise science for my major, and I wanted to go into PT. Then starting towards my end of my career there, I kind of noticed that I kind of wasn't interested in the field of PT as much as I thought I would be. So one of my buddies at the team transferred over here to the engineering program. He told me that they had a nursing program starting out. It was already in their first year here. So I got in contact with Dr. J, which is the founder of the program here at LTU. And then we got in contact and we met. And yeah, so that's kind of how I came over here at LTU.
That's very interesting. Yes, before it was only engineers and architects.
I know, I heard.
Mostly. And my classes it was one female to 8 males, and they were mostly architecture and engineering. So classes are definitely different. I never really had to take a science class before.
Man, you liking it now?
Well, it's challenging. I will say that nursing is not easy, but I like the challenge, and I appreciate the learning now that I'm older.
It's kind of like, for me, in the beginning, it was kind of like a learning curve because you look at something in the book, but then you have to totally know the whole process and how it works. You can't just like memorize it and like write it down, which was kind of like the hard part for me in the beginning.
Yes, it's the applying part.
Mm-hmm.
So you're actually learning it. So that's what I like about Lawrence Tech is that they really do demonstrate the theory and practice.
Yes, like the hands-on portion. So like I'm the type of person that can learn in a book, but I learn better hands-on. So here at LTU, they made a brand new simulation lab, which is fantastic. Now, I think her name's Renee. She works there. That's kind of like her baby over there. She has the mannequins now, and they're set up to computers. So we would go down there, like a simulation day, they would call it. They put a scenario in the computer, and we don't know what it is. So we go into the room, and it's kind of like a real-life situation, and you got to think and react quick. So I think that's kind of one of the perks of this program.
You even mentioned having to make fake calls of pretending like you're in the scenario, and that's incredible because that's something that's super important in the field of nursing.
Yes, so calling providers, some nurses or people get nervous about it because they don't know how to approach the person. I mean, at the end of the day, they're a person just like everybody else. So we would practice call on a phone. So, like, say if someone needed a medication, they didn't have it in their order, they would pick up the phone and be like, hey, my name is Nurse Ken, our patient needs a medication. Can you please prescribe it? So it kind of just gives you like a run through of what it's supposed to be like in a real world situation, which I think if you're not working in the hospital at the moment while you're in school, because I know it's hard to do both from firsthand experience, but that will help you, in the long run, get your feet wet a little bit, if you will.
I'm excited about that. So you are definitely farther than me in terms of how far along we are in the nursing program. So I'm my first year in.
Okay.
And I still have quite a bit to go
Mhm.
still, even with the credits that they're going to take. But you're farther down the road, so I actually could learn a lot from you. And so how far are you along in the program?
I'm in my senior year, so this senior year I had to do it part-time, so spring 2025 is when I'll be done. So just finished complex needs and transitions classes this semester. So it's a long road, definitely worth it, definitely worth the heartache, that you're about to experience.
Exactly. I think that helping people and seeing that you're making a difference is something I'm so passionate about going into this career, that I can actually see and help people in a way that is needed. And there's a lack of nurses right now. So great for anyone who wants to join the program. It's never too late. I am a walking example that I'm going back at the age of 34. Hate to admit it.
I am 29, so we're not that far apart.
There's so that's
Hey, you're
great.
never too old. Age is just a number. If you want to, just apply yourself and you'll get there.
I think that Lawrence Tech really implements that kind of mindset as well.
Yeah, relation-based care they really focus on here, which is treating the person as a whole. So, treating the person as, not just a number or a person in a bed, as an individual.
So have you been working at the hospital yet?
Yes. So my personal experience, I've been working as an unlicensed personnel in the hospital for 4 or 5 years now. I worked my way up. I was a nurse assistant, patient care tech, and then after MedSurg 1, you're able to apply for an intern. So I got nurse intern. I was working at Extension Southfield, where this program is affiliated with Extension. So we do all of our clinicals through them. It's good because I feel like you kind of get a head up on some aspects of it.
Definitely.
But yeah, it's
I'm
good to get
excited.
balanced out though. You can't focus too much on the work. You gotta, So is that what you want to do? Do you want to work while you go to school or wait till you're done?
Yes, I want to start working in the medical field as soon as next year. Hopefully, I was talking to one of the new advisors that I could possibly start working in the hospital as soon as next year. And so I'm ready to get my foot in the door, some experience, and get to see what I really want to do within it, because it is vast. There are so many different sections in nursing that I want to figure out my kind of like niche.
So do you have any particular like areas you want to work in for nursing? Like different, like maybe like a certain type of unit you want to do? Maybe like there's ER, there's critical care, there's OR. There's a whole bunch of avenues you want to go. Is anyone like kind of like spark your interest at all?
So I would like to dabble in them all,
Okay.
but I have two contrasting ones that I'm very interested in. So I actually like the psychiatric portion of nursing, which is difficult, but that is something that I'm very passionate about. And then also, I would be very interested in delivery.
That'd be good because Dr. Moody here at LTU teaches that she's very good. The rotation is good. But I had mine at Extension Oakland, so it was good. It was a different experience for me personally because reading it in the book and then actually seeing it in real life in a human being, that's kind of like it brought it all together. So
Wow.
that'd be very cool.
That would be incredible. So I know that they're paired with multiple ascensions. So do you get to pick your location?
It depends on your location where you live because when they're doing the divvying up of each location, some people that live out by Novi go over to Novi, and some people that are closer to the Metro Detroit area go to Ross. So it kind of just depends where they place you.
Oh, wow. I didn't know that. So that makes me even more excited.
You can request too, because they send out the sheet and you check off like what area like you kind of want to go to.
Oh, very cool. So I thought it was only one central location at first.
No. So like each clinical rotation in class goes to a different site. So for my experience, my MedSurg 1 was at Extension Macomb, and then MedSurg 2 was at Extension Southfield. And then, the side ones that were labor and delivery was at the Warren or Macomb. And then the psych one was at Oakland. So it kind of varies. I don't know how it will be in the future, but that's kind of how it was when I went through it.
Very cool. When I went to school here for my media communication degree, Lawrence Tech really is driven by being taught by professionals who actually work in the fields. That's proven true back then, and now that I see it in nursing, that's also proven true. So our teachers are doctors, they are nurses, they've been through it.
It's a good learning environment, and it helps you with the one-on-one experience, because the nursing program class sizes aren't like other programs that are like hundreds and hundreds. It's kind of more smaller, so you get one-on-one instruction. And if you need help with anything or you're struggling on a topic, don't be afraid to reach out, because they're more than willing to help you. And them working and teaching at the same time helps keep you up to date on everything new that's going on.
So I have a great question. Are you afraid of blood, or is there anything in the field that you were somewhat apprehensive about getting into it?
The sight of blood, not so much, but my first experience was when patient has C. diff, which is like a bowel disease where the stool becomes like liquid, like soup. And having to change the bed on that first time I saw it, I was like, I am not going in there. And it has like a terrible smell to it where you just like catches your breath. So that's kind of like, I know it's that type of topic, but that's what kind of like caught me off guard on that, actually. And there's one funny story with the blood. In labor and delivery rotation, we're at the Warren, and one of the student nurses, her name's Shannon, she graduated in cohort 2. Her patient was actually giving birth, so she was able to go in the room and see everything happening, and she actually got blood on her scrubs from like the placenta and everything coming down. So I was outside in the room in the hallway peeking through the door, but she was the one that got to experience that. And that's kind of like one of the craziest experiences that I've had on rotations.
I'm excited about all those things.
Yes, you'll be experiencing a lot.
So believe it or not, I actually missed the part of delivery in my health class in high school, so I never actually got to see the whole birth.
Well, you will be getting experience here, because some students saw C-sections, some students saw live births, so it just depends on what your patient has and scheduled. Because sometimes if they have live birth C-sections, they let you go in like the auditorium part to watch it, but like each student gets picked per week, so it just depends on what day your week is.
That's amazing.
Yeah.
So you're graduating soon. What is your first ideal job in the healthcare field?
So yes, I graduate spring 2025, so that's soon. My ideal experience, I kind of want to go in critical care setting, like ICU part. I know like most new grads don't go straight into it, because it's kind of like they want you to have med-surg experience before you go up to ICU. But yeah, so that's kind of the ideal situation that I want to. If I don't get it, it is what it is. I'm not gonna be mad about it. Just have to prove yourself and work your way up.
What draws you to ICU?
You have to watch the whole person in real time, so it's kind of more like intensive care. So you gotta continuously look at the labs. You gotta continuously monitor the patient, their O2 stat, how they're doing, their level of consciousness. And you're always connected to the provider, because there's always a provider there. So a provider's like a middle level, so like a PA, MP, or the DO, like the doctor will be there. So it's kind of, I know, it's more like a cohesive team experience. For me, I see it that way.
I have a student question for you.
Okay.
So how do you balance having to go to the hospital going to school and balancing the other.
So when I first started out, I was working midnights full time when I first came here, and then so I would get 7:30 p 7 to 7:30 a. I had class at 9. I had biology class at 9, so I would go straight from work, get coffee, bagel, come to the parking lot and sleep for like an hour. So it's definitely a dedication on what you want to do. You got to put priorities first, and if that means not having a life, that seems too extreme, but you got to just do what you have to do. And that's kind of what I did. I pushed everything aside just to focus on this because I didn't have any other avenue besides this to go to. So I knew I had to, go all in on it. And that's the type of person I am. Like if I find something interesting, like I have to just go 100% on it.
I definitely agree with that. And when I was younger, struggling to get my degree, I was balancing so many new facets of my life, like a social life, all those things. Now that I'm older,
It's hard.
I'm able to dial in a lot more. I think passion is huge, and it's never too late to go back to school to do what you really want to do,
Yes.
or even switch in the middle of your career if you
True.
wanted to do something different. It happens to a lot of us. I will say that I am happy that I have a degree in media communication because I see it working in aspects of nursing that will prove to become powerful and helpful. Especially, I just took a class on healthcare, politics, and ethics, and it's about using your voice. And I can still use that and use a voice and use the things that I was trained to do in media and communication and being able to speak on behalf of patients, other nurses, and advocate for the whole healthcare industry.
Being a nurse is not just being a med passer and looking at a computer for orders. You have to know. You have to know what's going on. You have to be an advocate. You have to be part of a team. So some people like to work as individuals, which is fine. But at the end of the day, the shift that you're on, that's like your team for the day. So if there's anything that your coworker needs help with, you would likely oblige and go help them because if you need something, I would like someone to help me out. So it's kind of scratch one back. One scratches the other type.
Yes. And I think that you being the positive force in the industry, it allows other people to feel comfortable to speak up as well. So it's a ripple effect. I was looking at becoming a midwife possibly, or even a PA, but a midwife was very interesting to me. So that would take it, the delivery whole aspect to another level.
Yeah. So labor and delivery, just hit the books hard to learn everything about it. When you're on the unit, try to make sure you make connections with nurses. Maybe even if the nurse manager is there, you could strike up a conversation with her. Small talks. Definitely make the right connections because that'll help you out.
I think we are always learning in this profession. I know that we are going to continue our education because it's ever evolving, ever changing. So that is something that we have to consider throughout our career. So it's surprising this is actually my first podcast that I've ever done, even given that I have a degree in media communication. But you've been a pleasure to speak to. Thank you very much for coming out here and talking about nursing and the nursing program at Lawrence Tech.
Well, thank you much for having me. I appreciate the opportunity, and go blue.
I'm Marisa Zilli. You've been listening to LTU Perspectives.